Hello, Nasdaq followers, and welcome to another episode of Behind the Bell. I'm your host, Lyanne Alfaro. We're leading up to the closing bell right here at the market site, getting ready with Rusty France, CEO of NextGen, which is transforming using technology, ambulatory care and services. Thank you so much for joining us today.
Thanks for having me.
Now, tell us a little bit more about NextGen, which has been here, you've said, once a year for the last at least 5 years.
Well,
since it's been listed.
Years, but probably 36 years since it's been listed.
Incredible.
I've been here almost every year since then. So it's great to be part of a company with that kind of tradition.
So tell us a little bit about what NextGen does and how it uses technology.
So NextGen's really focused on providing affordable, accessible, and high quality care and enabling the providers who do that every day. And so how do we create a great patient experience? How do we create a great provider experience? How do we ensure that when a provider's giving feedback to a patient, they have all of that patient's information in front of them? And then how do we make the underlying financial part of healthcare really work well? And if we do that well, then frankly, it helps every single person in this country, because what you want is you want a visit with your provider where you're talking to them, not their back. You want to make sure that you can identify who the right provider is. You want to make sure that when that provider is talking to you, they understand who you are as a patient and your entire history. And so by bringing all this to the table, bringing technology, increasingly we're enabling our client base to serve a broader and more effective part of the population.
Yeah, and this is, I'm sure, not only about it being a better experience for the patients, but also for the provider to have all that information at their fingertips.
Well, and to have it in a way that makes it efficient. The reality is providers got into medicine to bring health to people, not to spend all of their time pounding information into a keyboard. And you want your provider to be satisfied and feel the joy that they got into medicine for in the first place. And you do that by enabling them to quickly get the information they need, to quickly impart the information they need into technology, but spend most of the time both treating and communicating with the patient.
Absolutely. Now, NextGen, let's talk about its growth and how long it's been in the industry. So you are almost 3,000 employees strong today, serving how many providers?
Probably 90 to 100,000 providers across the nation.
Incredible. And how long has NextGen been in the industry?
So NextGen was actually founded in a garage by a gentleman named Sheldon Raisin, who is here with us today to ring the bell. 46 years ago, the company was incorporated 45 years ago, went public in December of '82 on the Nasdaq, and so has been one of the longest serving companies on the Nasdaq. During that time, started out as a dental transaction company, but since then has really moved into the medical side with electronic health records, practice management solutions, and now is taking another step forward into the behavioral health space, a very important and emerging part of the national healthcare ecosystem. And so as we start to really now look at how do we integrate care, and so integrated care isn't just treating a patient's affliction, it's treating the whole patient. And it's whether it's treating the brain, the most important organ in our body, from a behavioral health standpoint, or providing medical or dental services. It's really providing how do we keep the population well, how do we lower cost of care as a percentage of GDP in this country. We do it by providing accessible, integrated care to the entire population, and that's really what we're about.
There's several touch points there now. Looking at a wholesome and integrated healthcare approach is definitely where the future's at. But also this month, when it's Mental Health Awareness Month, talk about how mental health is just as important as physical health.
Yeah.
It's great to have you here and great to have the founder here as well. Yeah. What are some of the big shifts that you've seen for NextGen and the industry as a whole in the last 46 years?
You know, it's been interesting to watch. We've talked about value-based care since I first started in healthcare in 1993, right? And aligning the interests of the patient, the provider, and the payer, right? And so basically paying for outcomes, not paying for work. And so what we've really started to see now is it's starting to move from being a conversation about this transition to value to being the reality of the transition to value. And you're seeing providers enter into the type of relationships with a patient where the provider is compensated to proactively keep you well rather than wait till you get sick. Behavioral is very important in that as well, right? Because a lot of complex and costly medical problems have their roots in behavioral issues. Right? And so really all of this shift is we're starting to really figure out how do we use our money to drive outcomes rather than just use our money to pay for tests and pay for work and pay for procedures. And to me, that's a great step forward, not just for the healthcare industry, but for our entire society. Right? I want to know that my insurance company and my provider both have the same interests as me, which is to stay well, and when I happen to not be well, to get back to there quickly. So I see this as a great shift. It's enabled by technology, by data and analytics, by interoperability, but it's also enabled by the great clinical workers that we have across the country who every day wake up and try to figure out and want to exist in a system where they're compensated for keeping people well.
For keeping people well, and for also making our systems more efficient and
Right.
making them more integrated, as you've mentioned. So that is all super important. Talk to me a little bit about the employees at NextGen and the work culture. You've been in your CEO position for almost 5 years at this point.
Yep.
What is it like to be an employee at NextGen?
Well, I mean, I can speak from my seat, but I came in, my goal is to create the environment that I always wanted to work in. Right? And I guess emblematic of it actually is the event that we're about to go on, which is ringing the bell. We have organizational values that we refreshed when I came in, and every year we have a program where peer nominated, manager and below, for people who truly exemplify the people that are the informal leaders in the organization. And those people are the folks that are coming to ring the bell today. We have a very client-facing culture, but on top of that, we've really worked hard to create development opportunities for employees, but also just to create an accessible, I believe in a very flat social structure. You have to have hierarchy in an organization because decisions must get made, but we're all just people working together on a great mission. And to me, Peter Drucker had it right. Culture eats strategy for breakfast. If you don't focus on the culture of the organization, then your strategy is just going to be a PowerPoint. It's not going to be something that you actually deliver. And so we've been really fortunate to have folks that really buy into the system, and on top of that, work collaboratively together because we're on a great mission. We're on the mission of healthcare. And so culture to me it's the foundation of the success that we've had as a company over the last 4 years.
And that is some great food for thought to end on here as we head to the closing bell. Rusty, thank you so much for joining us.
Thank you very much. I appreciate the time.
Nasdaq followers, please stay tuned for the closing bell with NextGen happening here on the Facebook Live channel in just a few minutes.